Welcome to the Pro Aging Podcast. I'm Steve Gurney, founder of the Positive Aging Community. We're excited that you can join us for our interactive discussions with pioneers and thought leaders on a wide variety of topics related to aging and longevity. We're able to bring these discussions to you along with copies of the Positive Aging Sourcebook thanks to the support of our Positive Aging Community champions. Visit proaging.com to connect with them and find hundreds of other resources. Well, today we have a discussion where we're going to learn all about the innovative Namaste Care Program, which was developed by Joyce Simard. And this is an approach that brings a new approach to caring for people, especially those with advanced dementia. And today we're going to find out how one of our Positive Aging Community champions, Williamsburg Landing, was the first community in the state of Virginia to create this innovative Namaste Care to improve the lives of the residents, the families, and provide better direction for their staff. So let's jump into what I found to be a fascinating discussion on the future of caring for our loved ones. And let me let our YouTube and LinkedIn people in. And we are going to have a great discussion today. And I've been looking forward to this for a long time since I learned about this unique program called Namaste Care. But why I really am excited about this is that you can see on the screen an innovative program for people with advanced dementia. I feel like a lot of the things that cross my desk that are related to dementia and Alzheimer's, oftentimes we're talking about early stage programs and things like that. And I know that the advanced form of this disease is just heartbreaking to so many families. So whenever we can share some tips, suggestions, a program, and spotlight some innovative ways to communicate and treat people with advanced dementia, I think it's very important. And to help us learn about this is actually a practitioner of this who's going to share with us what this program is and how it works in the community that she serves. And that is Pattie. And I'm not even, Pattie, I'm going to let you pronounce your last name because I think I am, even though I practiced it, I want to hear it come through your mouth first. How do we pronounce your last name?
Gaudio.
Gaudio. Okay.
Gaudio. Most people ask that.
Gaudio. All right.
The second question is, are you related to Paul Gaudio of the Four Seasons?
I love it. Well, Pattie, thank you for joining us. I'm really excited to learn more about Namaste Care and how you use it there at Williamsburg Landing, which is the first senior living community in the state of Virginia to create a Namaste Care program. But one of my favorite things too is to get to know our guests. And so before we dive into this, give us a little bit about your background and what got you into this as a career path.
Well, I like to say I have an eclectic background. I grew up in Queens, New York, which usually a couple of paragraphs into my speaking, you can pick that up. I went to Queens College, majored in biology, and I became a chiropractor. So I had a family practice up there for 10 years. And then I had my mother as the receptionist for me. We moved her up by me because she was a widow by that time. And lo and behold, I met my husband up there where I was practicing, and we got married in 1987. By that time, my mom was just starting to have dementia. And really, by the time my husband decided to retire, he was 22 years older than me. We were married 27 years, but we wanted to move down to Virginia, and we decided to move my mother with us. So in the meantime, by the time we ended the practice, because my partner was moving to Florida, and I did teach high school biology for a couple of years. We moved my mother down here. And at that time, I chose not to go back to work, but to be able to visit her every day because I felt that relationship and connection was important. Well, that was 1997 to 2001. And let me tell you, visiting a long-term care community with people with dementia every day for 5 years, that just triggered. I just felt so driven to meld my medical and teaching background and get into gerontology, and
Wow.
specifically with dementia.
Well, as you know, I mean, one of the good things about this business that I really like is I feel that most people are driven to it by a personal story with the drive that we can do better. We can do better collaboratively. We can do better as an individual. And so I love your story, and it's unique. Now, one thing that I noticed when I was putting this together is that you have a degree in dementia from, like, this is not a certificate. This is a degree in dementia from a university. I've never heard of that. Tell us, number one, what college did you get this from, and a little bit more about that program.
Yeah, it was very interesting because I was working with dementia at Williamsburg Landing for a number of years. And I actually, excuse me, 4 years ago, I guess, they have an education fund here that I could use part to pay part for it. And I said, you know what? Why don't I just look into getting a master's in gerontology? So I did join the university, was accepted by McDaniel's University in Maryland. It was, virtual, and took 2-3 credit courses. And while it was wonderful, it was very good information. I said, I'm gearing everything toward dementia, but at this point in my career, I just want to be more focused solely on dementia. So I looked online, and at that time, I only found really 2 master programs in dementia in the United States. They were both geared a little bit. I think one was Texas, one was Chicago. It just seemed to me, looking at the curriculum, it was a little bit more geared toward going further into research, things along those lines. So I started looking elsewhere, and I came across the University of Hull in England. A number of colleges over there do offer a master's degree in dementia. And oh my gosh, going on their website, it was just wonderful.
Now,
They,
what was that university again?
the University of Hull,
Oh, Hull.
Hull,
Okay. Okay,
and
got
that was located in England. Um, I applied there, and really, you go through the whole medical background, of dementia and the disease process. But their whole program was geared on basically a human rights and dignity kind of purpose throughout dementia. So it's basically how to help people journey and their families throughout the course of dementia. How can you give them the best life possible? So, we covered all the basics. Then there were 12 weeks on living well with dementia, 12 weeks on dying well with dementia, 12 weeks on the systems in the community. What can we do really to ease the things that are going on, to help people live as well as they possibly can through dementia? Because, unlike like any other chronic illness, you really have to make compensations and adaptations as you come through it. And you can continually make them in order just to keep you connected and keep you as independent as possible and keep you engaged in life for as long as possible.
Wow. Folks, you saw I pulled up the website, and I'm going to drop the link in the contact in there. As I was looking at that page, I've never seen anything like that. And boy, you really are a curious educator to do the research, to be discriminating about your own education, and to identify that university. That's really impressive. I think one of the things that I'd like to follow up on after our discussion is, let's get somebody on from that university to come on and tell us a little bit about how and why they created that program. Before we were chatting, we were both talking about how, while the US has a lot of innovative treatment, there's so much going on around the world. And it's inspiring to know that there's a specific high level program in England like that
And
focused.
Steve, one of the really wonderful benefits over there is we had virtual meetings once a week. We talked about, what we were talking about in the curriculum, but most of the students were from England. However, I was interfacing virtually every week with around the world with students from Africa, Greece, Canada, Ireland. So I was really able to see what every country is doing and utilizing and, their challenges and some of these lateral thinking solutions that, we haven't come up with yet here.
Man, I love it. All right. Well, holy cow, we could just talk about your background in this the whole time, but we want to get to Namaste Care. So let's first start with this Namaste Care program, and then we'll move into, I know you've got some photos and you can show us, what Williamsburg Landing, the memory care looks like there. But tell us a little bit about the program, and I'm going to pull up their website too. But Namaste Care, tell us a little bit about it, how you discovered it too.
Well, when I came here back to work, my mom passed away in 2001, and I came to the landing in 2003. And they were really on the cutting edge for that time because my predecessor, Nancy Revolta, who was a real visionary in the field, and they embraced that and created a position for her here as far as helping people journey with dementia, with caregiver support groups, with putting programs together, just to stimulate every area of the brain, to keep people as engaged and independent as possible. So I worked with her basically from 2003 to 2010. I had excuse me, what conferences, experiences. By 2010, I was also coordinating all of the activities in our secured memory area. And lo and behold, my husband, which was a surprise to me because every female on my mother's side has dementia, nothing in his family, he came down with a combination of Alzheimer's disease and Lewy body dementia. So by 2010, I had to leave work because I couldn't leave him home alone. And I was able to care for him 4 years, being medical background. I knew what we were facing with dementia till he passed away in 2014. However, back in 2009, before I had to leave, I read a wonderful book by Joyce Simard, The End of Life Namaste Care Program. And I just happened to have a lot of copies. I passed them out. And it was phenomenal because she started out up in New England in a long-term care facility, said, oh boy, this isn't for me. But when she saw the need for people in late stages of dementia, it's basically when they get to that end stage where they can no longer verbally communicate, they really need total care. They can't eat anymore. They can't walk anymore. Usually they end up being in a long-term care facility because most memory secured areas are geared for ambulatory people because they're secured, people who are going to leave. So family members are upset when they have to transfer them because they feel, well, this is where they know my loved one. This is where they know dementia. And often in long-term care, they'll have to get brought out into a common area, often left by a nurse's station, because if they're in a regular activity, they can't participate. Their visual field shrunk, their hearing isn't as good, and they'll end up sleeping somewhere. So she created this program, and other places do have it. A lot of hospice agencies, when I was trying to research it through the United States, and I know there is an adult day insight, which is wonderful up by the DC area, that uses it during the day. And that was her program, basically, that you take every person, late stage dementia, living in a long-term care area, you gather them for 2 hours in the morning after their morning care and breakfast in a quiet, secured environment. And you do multisensory engagements. You welcome them, you know them, you're next to them. The whole goal here is to have them feel the presence of people around them, give them multisensory stimulation because that's the best way that they connect to them. You monitor for pain because somebody's in pain and they're not verbal. It can be kind of hard to detect that. Offer hydration because urinary tract problems and infections are so prevalent in the older population and especially in dementia. And for 2 hours in the morning, you create them in this atmosphere that's just engaging to them. They break for lunch. And then for 2 hours in the afternoon, you repeat the same thing for those people who are appropriate. You can put on nature videos, music, a lot of music, movement with music, different sensory, kind of objects that are hold. We have themed topics that we just talk about, just the rhythm of the voice. So that was her program, and she saw such a need for this. Excuse me. So 2009, I brought this. I said, wow, could we just have a private space? 2 hours in the morning, 2 hours in the afternoon. And then we tried to put it in the budget for the next year, but it just didn't happen. Then I had to leave in 2010. I talked to a few other communities while I was off about the Namaste Care Program. And then when I came back in 2015, in this position now, I mentioned the book to our CEO at that time, and didn't take off right away. However, at one point, we had 2 floors of long-term care. So the decision was made to move everybody down to the first floor, leaving the second floor empty. And they were taking ideas, well, how can we reutilize this second floor? So I was like, I know. So I talked with leadership here, wrote proposals. It took a little while because we have a board, and everybody then was on board. And we were able to actually not only take it from our memory, from our long-term care, but to create a Namaste community, which is just a private area, just with the whole sense of it, the colors, the openness is just all geared toward that population.
Wow, man, what a journey. And I'm glad you told the story that way, because it's, a lot of times we don't realize how hard it is to make even common sense, subtle changes in our current healthcare infrastructure, or in a very well-led, innovative organization. And a lot of times the root of change like that isn't it. You need an individual that is not going to accept no as an answer, that is just going to constantly sort of try to reposition and all the proposal writing and all of that. But before I really want you to share your photos of your center, and then I know you've got some pictures of some residents, and you can tell some stories. But for folks that are not familiar with Williamsburg Landing, this is a life plan community in Williamsburg, Virginia. Would you like to share a little bit more details? And I can pull up the website as well.
Yeah, life plan communities are just there to serve you throughout your whole life. We have independent living residents. We have assisted living if they need more help getting through the day, maybe with mobility, medication reminders, taking medication that's staffed by LPN nurses, our nurses 24 hours. We have long-term care. We also have our memory support, which is a secured area. We opened up about 5-6 years ago an all-day adult day program that runs Monday through Friday. That's for outside in the community too, which is wonderful. And we have our Namaste area. So basically, it serves to bring the highest quality of life that you can at every level, depending on whatever your needs may arise in the future. And I find what's so important about that is you have people like me that are through all the areas. So you have that connection. People know you. The staff starts to know you. So you're not just coming in someplace. So it's just a continual flow.
Got it. All right. So now let's take a glimpse at if you want to share the slides that you were showing me earlier, so that we can get a handle of the environment that you've got, that where you're delivering the Namaste Care Program. And I also want to reference when we'll go back to this after you talk about that, but like looking at the Namaste Care website, for folks that may be caring for loved ones with advanced dementia, they have an individualized program like the practice that you're going to see here that Pattie's going to talk about at Williamsburg. Some of these things we can all implement with our loved ones at home or in a home care environment or in a different type of setting.
Absolutely. Excuse me. As I said, a number of hospice agencies utilize this, and on Joyce's website during COVID, that threw us all for loops. She converted it to Namaste in a bag. So even in communities, you could have all of these things in one location for one person that you could just bring to them, which you could easily do at home. She has a number of videos on there. And I do just want to give her a shout out. I have to tell you, she is the most altruistic, caring, loving person. She just wants to make people's lives better. She was open to me. She returned my calls. She did virtual meetings with my leadership and me. She did not take any money for this. A lot of things charge for their programs, nothing. This is totally just such a mission for her to spread this program for the quality of life. So basically, the Namaste, we took half of the floor. So we were able to really open it all up to make it very bright and light. I like to use this. It was actually from Clipart a long time ago, the two hands. She chose the Namaste name, which is actually, if people take yoga, it's a common term. And technically it means honoring the spirit within. And she said that's so appropriate for people in late stages of dementia because they're in there, their identity's there, their spirit is there. It's just they can't respond the way they could in the past to the surroundings. So we actually had a staff member who was artistically oriented who came and painted this as a wall mural for us.
I love it.
So we have, it's kind of in a U-shaped. There's one corridor with rooms on both sides, and we opened up this middle area. So you can see in the distance is the nurses' station. Everything's open, so everybody can see each other. We have some tables here. We also have a dining room at the other end, but especially for breakfast, we work on everybody's schedule, so some may get up a little bit later than others. They all basically, one may be able to feed themselves, but they usually need assistance with feeding. Colors on the wall because that changes. And then we opened up this area here, which is the Namaste gathering area that we can make a circle. Everybody pretty much is, as I said, non-ambulatory. So we have them in some reclining chairs that we can get them ready, settled, bring them out here. And a Namaste day, basically, once we get them settled, we have lap blankets that our independent living community, and I'm sure wherever you live, there's different knitting groups or crocheting groups. They'd be happy to donate some things. We made lap blankets for everybody. We welcome them. That is so good you're here. We use nature sounds, music. We have a towel warmer. We start with therapeutic touch. So we use, with this warm towel, hand massages, facial cleansing, care, creams. The difference is you still get them ready for the morning, but the focus with these 2 hours are basically on pleasure, not on hygiene. Playing music. But as I said, again, it's just the feeling, the presence. People are around me. I am connected to somebody. Somebody's up close sitting with me. They just feel that. That's such a beauty to it. We opened up 2 little areas. We tried to keep everything as possible to eye level to a wheelchair because that's their visual field at that time. And then we have some wonderful volunteers. Now you're going to see a lot of Lucille. Lucille has given us her family a waiver to, show her picture and share it. So I've usually, kind of kept Lucille into these pictures. But we have volunteers that come over and you can see what a big difference They are. And most of these residents are nonverbal. They may say a word or two here or there. And sometimes it just melts your heart when you just see them come alive and do start to say a word or two with you. We have therapeutic visits from animals, and this is a wonderful, wonderful group, Fuzzy Ear. And they are the fuzzyear.com. They come from Gloucester. They are licensed to handle English Angora rabbits. They bring their bunny rabbits. They sit them. The residents just love them. They come alive. We also have them, of course, therapeutic pet visits, and we're lucky to have one of the lead nurses there has their own pet rabbit, so she'll just bring the pet rabbit in periodically.
Wow, those are some beautiful rabbits. I mean that's absolutely amazing.
The Angora ones are just full of fur, and they'll be around the Williamsburg area, just sometimes at outdoor events and festivals, and boy, they melt your heart.
Mm-hmm.
And then the family members. I mean, when we started it, they can't say enough about the program because it connects them too. They're welcome to join in. Once a month, we have a family gathering in residence that we just meet. We have a theme. We share the time together. And part of the thrust with this is late stage dementia. So this is life limiting. And we want to really connect them, get the word out there about hospice. Some are on hospice, some are not, and share together because the families are going through this journey together to really create those connections and help the family members as much as the residents walk through this time. And then, I mean, this look just says it all. My coworker just went, we have a little flea market here, got $1 scarf for everybody. When you put them on, well, although not the gentleman, when you put them on, it just lights up.
That's great. And so now sort of like I know I don't want to put you on the spot, but but like sort of before and after, like are not necessarily this resident that I'm sort of looking at right now, but any sort of anecdotal kind of before and after stories of folks that were how they were before they entered the program, and then as it starts to implement.
Well, the residents, a matter of fact, this particular one resident's spouse was, well, when is it going to open? When is it going to open? Because as with everything, when you're doing construction, opening it out, things always take a little longer than you thought. It just opened last April. Okay. And he couldn't wait for it to open. But then he started, well, she's getting such good care downstairs. I hate to move her. I'm not sure and all. And then he moved her, and he said it was the best decision. Not that she had wonderful care downstairs. She was, brought by the nurses station, and she'd sit and listen to them, back and forth as they talk. However, we're just able to create the whole environment for that level of care where it's colorful, it's quiet. There's not a lot of activity going around that can be discombobulating for that particular stage of dementia. We're really geared, we take care of medical, but it's really geared to a psychosocial model where we're just trying to take care of that particular thrust in this age group. Of course, the physical too, the medical too, but we just have more of an environment just geared to their ability to connect with the environment upstairs.
I love it. I love this approach. Okay, we got tons of positive comments. I knew the bunnies were going to draw some rave reviews. Pattie, I'm going to have you come back on twice. First, we're going to talk about the University of Hull. Second, I want to put together a panel of communities like yours that implement animals in a creative way. And I see that there's some people on from Inspirations listening to this. Folks,
yes.
These are some communities in Maryland that have llamas and goats and all these things. And it just magically transforms a community that people are nervous to go visit. They, into this just magical place. I mean, and I tell you, I stumbled in the other day to a nursing home that many years ago, when I would visit this nursing home, you literally had to walk around dogs because they had these wonderful dogs that were you could roll over them in a wheelchair and they wouldn't budge. And it was such a magical place. And the ownership changed, and I kind of walked in, and it's like it was a different place. I was almost shocked that I was in the same space. But what I realized was how important the pets are. Those pets that are engaging just made a huge difference. So I want to get you and the Inspirations team and maybe some others out there, and let's really
Absolutely.
spotlight this.
Absolutely.
Okay. Suman asks, how much does this cost, and is this program covered under Medicare?
No, actually, no living area is covered under Medicare. Medicare just covers if you are in the hospital for 3 days and you need rehabilitation, Medicare will cover it. But it's, and you really have to talk with our marketing one,
Right.
basically the different prices. I'm really not that aware of it. All I know is that it's just a little more expensive than our memory support area is, and less expensive than the long-term care area.
Yeah, and folks, I mean, this is not like a Williamsburg Landing thing. This is like an elder care system, where um anything assisted living or or memory care. I mean, unless you're in a state that has a unique program, a lot of times, and you can sometimes tap into Veterans Aid and Attendance, but it's, Medicaid and Medicare, it's pretty much nursing homes and some other programs. Now, from a budgeting and cost saving perspective, I was glad that you spotlighted Insight Memory Care Centers, which is, daycare, and Williamsburg Landing also has daycare. These are ways that we can, take care of our loved ones, get a break, be able to sort of cobble together some care plans that can help those that may not necessarily be able to afford the full-time memory care support.
And of course, if somebody has long-term care coverage,
Long-term care insurance, yeah,
each one is so different too, depending on what their regulations, what they signed into. But definitely that helps.
Yep. And now, someone asked, I always like when people tell their stories because it creates curiosity. And they say, you said your mother was beginning to show some early signs of dementia. Are you willing to share some of the signs and symptoms of dementia that you and your husband saw in your mom? And great question there. I'm interested in your response, and I wanted to share something that I heard the other day on this topic. Like, what were the signs and what were the symptoms that you saw, and maybe some guidance that you can give to us who may be experiencing this as well?
Sure. And, because we have natural age-related changes with our brain, they realize now with functional MRIs that we can actually look in and see what part of the brain is firing during different thought processes and different things that we're doing. They did some studies on 20s, 30s, 40s through 80s, and they found across the board, as we age, as everything in our body does slow down, eyes get cataracts, hearing gets worse, muscles get a little weaker, digestive system, the brain's no different. So natural age-related changes, basically that frontal area of the brain, your attention, your problem solving, it shrinks a little bit. It's still there. You can still learn, but you have to put more effort into it. You can't multitask like you could because you have to make more effort to focus your attention. Also, you may that tip of the tongue syndrome. You forget to say a word. What is it? What is it? It drives us nuts, and that's my number one question. Am I getting dementia? No, that's normal. Usually it comes when you relax. The memory area shrinks a little bit, the hippocampus, all the short-term memory. You can still remember, but you have to put more effort into it. And your processing speed slows down. It takes a little bit longer if it's in there to get it out. that's just kind of in general what happens. Once it crosses over to mild cognitive impairment, which is a little more, and then into dementia, kind of the catch-all with dementia is when you really can no longer manage or get through the day without bringing in significant outside help. So pretty much, we can all have a little trouble with language, finding, the right word. Once we have trouble conversing, following conversing, that's something a little bit later. So with her, she had a lot of trouble with, I would say, the early stages, memory loss. Of course, I'd set things up for her. I'd set up pills, I'd set up things, but then she got to the point that she couldn't even remember to read it back to do it. Appliances got to be a challenge with her too. Well, how do I do this? Of course, when we have a new remote with every different appliance we have now, it's very difficult for even natural age related changes. But yes, it was kind of just the earlier stages were more memory loss, having to remind her different things, and then trouble figuring out how things worked.
Yeah, that would have been easier for her to do at an earlier stage.
Yes.
We had somebody on the other day that actually, it's a wonderful story. Sam Simon, he has early stage dementia, and he wrote a play about his experience called Dementia Man. He's reinvented himself to spread the word. But one of the things that he and his wife reflect on is that the signs and symptoms actually, they realize now that 3 years ago,
in hindsight,
yeah, because these things can be like, can be so difficult to diagnose, and oftentimes it's hard to get a proper evaluation. And then it can be he was misdiagnosed with depression, and then he was placed on medications that clouded his mind, that made it even worse. So hopefully that's a good response. Now, and let's see, Deborah has her hand raised, but that may be by mistake, but I'm gonna allow you to talk, Deborah, if you did have a question that you wanted to verbally express. But while we're waiting to see if she opens her mic, so now the program sounds, and somebody even referenced to this, is that, geez, this is like just a very easy to implement, simple, procedure.
It doesn't cost a lot of money.
Right.
You're using objects you have, around the house.
But the value, I think, that you've got here is that it is a program, it is structure that helps the staff and the team members. And can you comment on that and folks, when we're talking about staff, but the staff could be, you're caring for your mom and dad and you're sort of implementing this. What types of feedback have you got from the staff?
Oh, wonderful. Well, and I did write a 6-hour education for Namaste, and we also give it to all of our memory support nurses, that basically you want to turn, Kitwood was one of the first ones to take person-centered care and put it into a dementia perspective. And he came up, which I really love, it's the term malignant social psychology. And what happens is, a lot of times with people with dementia, we depersonalize them because we think we're doing them a favor. You take them to the doctor, you're talking over them. You're talking to them like they're not even there, that they can't understand you. We're doing everything for them. Well, they're having trouble putting on their clothes instead of with them. And that takes away their personhood. So part of this thrust with Namaste, and it should be through all dementia care and through every care in general, which I learned at the University of Hull, is relationship-centered care. Pretty much you want to develop that relationship. And that's a three-way street. That's with not only the resident, but the family members and the staff. Everybody should feel they're getting something positive by that interaction. And the staff does, because it really gives them the time to spend the whole day. And one other thing, they did a study in England, and that was in England, but they found with late stage dementia, other than doing activities of daily living, which is feeding, bathing, toileting, they spent an average of 2 minutes a day with the people. So
Mm.
part of this is not only those 2 hours that you're there and the staff just joins in. It's one big team effort over there. But you are okay, natural age related changes. I got sidetracked. But you are actually given the ability, and we do train different, not train, educate. How can I turn all activities of daily living into meaningful engagements with them, into taking that time to talk, to develop that relationship, to talk to them about their background. You know, we have a book about their background, and they do. The staff love it up there too.
And you know that so on for those, and I can see some of the names that are in the audience today, some really progressive, evolved care practitioners from different organizations that I'm aware of. And the reason I know they're progressive and evolved is they're constantly trying to learn about everything that's out there. That's why they're tuned into this. You know, um, the without sort of a roadmap, your typical care provider, it's very challenging. Like I went to visit uh, a family member of mine with frontal temporal dementia recently, who's in a nursing home, rather young man. And if you don't have a roadmap, if you don't have sort of like, here's my game plan. These are the topics that I know that he is interested in, and have a real conversation, you can see where a typical caregiver without that roadmap, who's all well-intentioned, it's kind of like, well, I've got to make sure this person is clean and bathed, but what am I going to talk about? What am I going to do? How am I going to, make an impact here? And I bet you anything that just the simple steps that you have outlined make a world of difference, and now create an environment that a worker wants to be in.
And yeah, we have just a little simple life story on each one. Our social work puts together a complicated one for other residents in memory support, but just simple. Anybody can open it up, read about the background of the person, and the staff there is wonderful. It melts my heart. I mean, they are just such a team. They give of themselves. The love they express is wonderful to see.
Well, another benefit and another thing that we've evolved into in the senior living space is it's a small environment. Like how many total people are in the Namaste?
12. We can take a total of 12.
Yeah, and I sort of feel like that number 12, 8, 12, 15, it's kind of the magic number that we've discovered with the greenhouses and the small house movement, and then implementation of this is that beyond that, it's just like, I mean, it can become unmanageable, and now you don't have the time and the energy to, as a care provider and partner, to devote to learn about that. Laura asks, and I sort of asked the same question, is how long is the waiting list for your community?
Yeah, well, we waited to take, we kept it at 6. We just opened it up December 1st to take 7 through 12 because of staffing. Since COVID, things have been a little tough. And we are waiting in all of our areas, really, here. We've been very selective now. We really want the right person. We've had some wonderful agency people coming in that are heartfelt, but then we had some other ones that were not. They just, were there for the paycheck. So we really wanted to make sure we have the right person. So now we do. For the ratio, we had one LPN and one CNA, up to 6 people working up there, which LPN, the nurse works hand in hand with medications, as well as helping them all through activities of daily living, just a team. So now that we have 2 CNAs and certified nursing assistants and 1 nurse up there for 7 to 12.
Well, I mean, and this is also sort of a state of our industry, or for lack of a better term, And I commend you and your team in Williamsburg Landing on having the discipline to stage this out based on the staff that you have. Because as, as you've described this program, you could open your doors and open to full capacity, but if you're understaffed, a program like this is not going to work, and having that discipline to build the right team, keep your occupancy at a certain level, get the staff, and then open it up. So folks,
So we are really just kind of getting the word out now that we
okay.
can. We do have a couple of people on a waiting list.
Okay. And then let's see, a couple of good questions. Christina's asking, it's only 2 hours a day. They live there full time.
They live there full time.
It's 2 structured hours in the morning, 2 structured hours in the afternoon. And then I imagine in between that is, dining, other sort of activities, but it's not as it's not the
well, we make sure and 7 days a week, that's important.
Okay.
We make sure that we have those 2 hours in the morning, 2 hours in the afternoon, that it's available. Not every resident is always up to it. They tend to sleep a lot more in the later stages. If they're up to it, that's fine. You'll bring them there. Some will doze in the chair, then come awake, then engage, then doze. And the dozing's okay, because sometimes when they're not agitated, when they're relaxed, when they're in the soothing environment, they do sleep. So it's not to keep them totally connected for those 2 hours, but we do that. We do 2 hours in the day, 2 hours in the afternoon. We bring in musicians. We have a harpist that comes in. It's just that sensory stimulation is there for those times.
Now, this always is mind-blowing to me, but Paro, who attends many of our discussions, is from India, and was wondering if Namaste Care Program is in India, but then also how can a caregiver learn or educate him or herself on the program?
Good question. And I know Joyce said, and this was when we started about 2 years ago, it was in 13 different countries. Okay. And the first time she called me back, she was in Singapore because she was guest speaking over there. So it very well could be. I don't know the specific countries, but I would say go onto this website. It explains it quite a bit. The book, Namaste Care Program book. The book actually is geared for setting up a Namaste Care community in a long-term care facility community. But you can pick everything that's used there for the things and just tailor it to your own home.
And then on the website, it's got the Namaste Care individual program, and you'd referred to that as the Namaste Care Bag.
Yes.
So like folks, some of you I know may be listening to this and you have a loved one in an assisted living, a memory care community, in hospice or a nursing home that might not have the resources and the leadership like Pattie to implement this program. But, one of the things is, getting the bag, going in there, and kind of this can create some great activities for you and your loved one. It
gives you something to do, because sometimes you say, well, we're not talking. And music, I can't talk enough about music, can just go in and pull out those positive emotions. Music that means something to you and your loved one or your family member.
You mentioned something earlier, and I'm glad that I meant to comment on it, but then we went somewhere else. But you were talking about, the importance of this as a relationship and knowing, the person. The other thing that we talk about a lot on these discussions is how, my mom is not herself anymore. Like, so when you've got a loved one with advanced dementia, it can be very frustrating because you're looking at this person that you remember in a certain way and they're not behaving that way. And but a lot of times, as I've talked to experts like you, they're at a different stage in their life. It might be 1970 and you don't remember them in 1970, but I think by using this approach and some of the other ones, if you can get, as their loved one, get in their space, um, that's very important.
Yes, yes.
Um, okay, let's see. What a wonderful, Sally says, what a wonderful resource. This can be helpful. They are all training home health care staff and caregivers responsibility. Betsy's trying to get this adopted, get the VA to adopt this type of care. Yeah, wouldn't that be wonderful? Winter growth, they have animals too. So winter growth, let's do a big thing on animals next year. We can do it a bunch of times. Oh, Martha asked, can you describe how you respond to hospice and death with residents? And this could go outside the Namaste Care, but just like I love hearing how we talk about death and the different approaches to that.
And that was something too in England, talk about different things. They actually have death cafes.
They've
And
got those here now, but I
do
know.
they really? With
Oh yeah.
people who, people don't want to talk about death. And some people, they want to talk about it, but their family, no, don't say that. I
Yep.
don't want to hear about it. But yes, so, it is, and that's one thing with dementia. It is life limiting. You will die with a progressive dementia, but it's so hard to pinpoint and prognosticate the time of death, because so many times in the late stages, it looks like somebody, in a medical, like it's different than somebody with cancer that goes down fast. So a lot of times physicians, you don't want to say, hey, maybe they are. So that's part of this thrust too. We have I bring hospice in to do some education for the family members, education for staff to take it home with their family too, but to really get hospice, because there's so much of a perception that people really wait too long. They think it's just when their loved one's actively dying, and they miss all of the support and the different ways that they can come in and get to know their loved one. So they do understand and recognize when they may be developing more pain and different things, that they can, better work with them. But we work hand in hand with hospice. Not everybody's on hospice, but if they are, they just join right in, with the group.
And then someone asked, did you say that there's a program that offers certifications in Namaste training? So like, is there sort of, if somebody wanted to follow in your footsteps, there's not sort of like a certified Namaste.
No,
It's
I asked Joyce
embracing.
about that, and no, but that's why I wrote my own.
Well, that's why I like having you on. I mean, because this is inspiring to all of us. Okay, is that if something doesn't exist, like your story, Pattie, is amazing because it's you saw that there could be change. You went out there and you found something that you embraced that mindset, and then you just figured out how to implement it in your organization. And folks, like, above and beyond this Namaste memory care, think about that as we're taking care of our loved ones, or if we're in a community, it could be somebody who is on hospice. Is if you've got a book that inspires you, Pattie is a living, breathing example of how you can take that to the next level. And then Christina asks, like, so Christina, she's with that Inspirations Memory Care community with all the wonderful animals and stuff. She was asking, do you do trainings? Like, would you be willing to work with other providers and kind of share some of your expertise?
Yeah, I would. I did a presentation. I'm not sure if she was there at Leading Age too. They had one on there about all the different animals and stronger brain, mind, different things. And yes, definitely.
So what I'll do, with your permission, I'll put your contact info on the page with the recording page. So if folks want to get in touch with Pattie, and at a minimum, we're at least creating a community of people that want to raise the bar of how we take care of our loved ones. And at a minimum, if it's sort of like an email list where it's like, Pattie, I'm trying this, what do you think? I think
Yeah.
that would be great. Okay. Whew, boy, that hour went by quick.
Did.
Is there anything like that you'd like to share that you haven't shared? Actually, no, I got one question that I have. When you talked about volunteers coming into your program, one of the things that I love about Life Plan or continuing care communities is that you have an abundance of independent older adults in close proximity to the healthcare facilities. Do you find that that many of your volunteers are the independent living residents in Williamsburg Landing?
Yes, yes, I do. They just want to do something meaningful and give back. And I do a education session for them too, just to understand the late stages of dementia.
I love it. I think one of the things that we sometimes see in senior living environments with multi-level care is where it's sort of like, oh, I'm not going to go to the third floor because that's where, the nursing is or what have you. And what I've found is that in life plan communities, when residents start helping out and learning that, wow, like this person here is lived an accomplished life, much more accomplished than I view myself, but they've just got a change in health status. So that none of us have a crystal ball, but the more volunteering we can do, the more we can help out, the more we understand it, and the more we can assist staff in creating a wonderful environment like yours. Um, all right. This has been great,
Wow.
Patty.
Thank you so much. I
And
love getting the
so,
word out there.
oh, me too. And folks, we're going to be seeing Patty again. We've already got two discussions that we're going to try to book with her in 2024, and everybody is very grateful for this. This is a great way for us to wrap up our live and interactive discussions for the year. But remember, I'll send out a list. We'll have this recording so that you could share it with folks, and then you'll have plenty of content, folks, that you can review. If you missed a discussion and it's on a topic that you thought was interesting, you can join in on that. But Patty, I hope that you have a wonderful holiday season, and most important, I hope that the people that you're caring with that have dementia and their families, that that the world is a little bit better place because we're pushing the envelope with a program like yours.
Yes. Thank you so much for having me.
You bet. All right, folks. We'll see you next year.